Today we will take a look at QIAGEN Clinical Insight. Our QCI platform allows you to answer three basic but important questions for anyone interpreting NGS variant in a clinical setting. Is the observed variant real? Is it clinically relevant? Or is it actionable? And this is what I will try to achieve today during this demonstration. The agenda will start with discussing about content and content-aware analytics that are required for QIAGEN Clinical Insight. What are the product values, product overview, and then a little demo within the interface. Before getting further along, I would like to provide you the intended use statement of QIAGEN Clinical Insight. This software application is not intended as a primary diagnostic tool by physicians or to be used as a substitute for professional healthcare advice. What is the QIAGEN knowledge base in content and content-aware analytics? We are achieving that by integrating, organizing, and synthesize the information. The way we are doing this is we are creating publicly biological knowledge from the literature and different databases. Then we are adding structure, allowing the connection between gene regulation, for example, to a disease, or even to a drug or to a tissue. Using that content and that ontology structure, we are developing and leveraging different algorithms to interrogate that content and allow you to make best decisions, such as cancer scoring, which is what we will discuss a lot today, or hereditary disease scoring, or causal network analysis. So in a nutshell, the QIAGEN knowledge base and content-aware analytics are integrating, organizing, and synthesizing the information. What is QIAGEN Clinical Insight and which value it brings to clinical laboratory? First of all, it is a comprehensive curation of clinical evidences. It allows you to report cases, to see drug label, professional guideline, and so forth. It is a decision support software, so you can classify variants, identify treatment options, and look at geographical clinical trial matching. It is agnostic to your workflow, so to your platform, sequencing platform, or your assay or your pipeline. The QIAGEN Clinical Insight can be integrated with any of the platform available. It allows you to find treatment and trial identification based upon the level of evidences, the expected drug response, prognosis, or lab-defined rules, for example. And finally, it's allowing you to have a customizable reporting system with the ability to capture persistent information from all the sample that you are looking at, as well as integrating the information within your LIMS system or even your EMR. QIAGEN Clinical Insight feature allow you to instantaneously compute variant classifications based on the pre-curated findings. You can see up-to-date drug label and professional guidelines, comprehensive and deep bibliography literature references, automatic treatment and trial consideration, customizable rule-based reporting. And the benefit that we'll provide to your lab is to reduce the time, the cost, and complexity of your interpretation, improve the ability to determine disease-causing and actionable variants, increase treatment and trial matching, build a private in-house experiential databases with each of the variants, and also provide fully transparency and control of your NGS variation interpretation. How do we achieve these automation and that interpretation? The way to achieve that and allow you to find actionable and report on those actionable variants is using standardization rules and interpretation methods. So if we take, for example, somatic cancer, which is what we'll be discussing during the demo today, you have critically relevant variants for somatic cancer. They could be actionable or consensus variants. They could be potentially actionable or emerging variants. It could be based on initial evidences, so more used for prognosis-based type of variant, or exploratory and research pathways type of variant. So in somatic cancer, the goal would be to, we're going to classify those variants, and your interpretation will be to find the clinical relevance of your variant, keeping yourself current with the drug and the trial information, actionability of the results, so which one is actionable. Look at different other example of clinical cases, so you can see patient outcome, as well as capturing outcome of the information. We currently also have a solution in early access for hereditary and germline conditions. And the way the algorithm and the standardization is working in there is you detect the variant, we will do the annotation, and then we use the ACMG classification guideline to allow you to know which of those variants are benign, likely benign, of uncertain significance, likely pathogenic, and pathogenic as well. And QIAGEN Clinical Insights will classify them and provide you the bibliographic references to help you with that interpretation. But today we will concentrate on somatic cancer for this demonstration. QIAGEN Clinical Insights is at the end of your NGS workflow. So if you think about sample isolation, then you do target enrichment. This is all wet lab-based experiment. Then you do library construction and you run your sequencing. After that, QIAGEN has a lot of different products that can allow you to do data analysis, but QIAGEN Clinical Insight will be after the data analysis. So when you have the variant that are identified, then we are wrapping around that knowledge of information to allow you to do the interpretation. And to do your reporting as well, we provide you the interface to select which of the variants, which of the treatment, which of the bibliography you want to report. So the application is divided in 3 sections: the variant list, and the variant list will allow you to see information about your test, overall filtering classification, overview of all your variants. So in this screen capture, we have 2 variants, and include also Y type or copy number variation and treatment information that you can bring into your report. The second section is the variant detail. The variant detail will provide you specific information on of every individual variant. It provides you a semantic workflow, so we can look at the actionability with the treatment information. And you have supportive literature and clinical case count that we're going to take a look this morning or this afternoon. Finally, the last section of the application is the review and reporting. As we go through the evaluation, one thing you will notice today is I will build a report, and I will decide at the end to report out and see what are the overall interpretation for my variant, or for this case, what are the reportable variants, what are the treatments associated with it, and the bibliography that I want to report. So the review and report section will allow you to see just the overall interpretation that is based on your selection, see and comment any section that you want to put in your report, and finally look at the relevant bibliography and report out, whether in a PDF format or in an XML format. So what I will simply do at this point is I will turn around and I will quit PowerPoint, and we're going to go within the application. So this is the interface of QIAGEN Clinical Insight. As I mentioned to you, you have the 3 sections for every review test: the variant list, the variant detail, and the reviews and report section. On the right-hand side, you will have your tests as well that you can access. But today we will take a look at an example in lung cancer using one well-known variant for lung cancer, so a deletion in the gene EGFR. So what we can see from that variant list in the top gray section, we can see information about your sample, so metadata about this sample. You can see your laboratory accession ID. You can see the product code. So if you are running multiple test codes within your laboratory, You can see your hereditary code, your breast cancer code, and so forth. You have the tumor content within the somatic workflow, as well as other demographics that you choose optionally to send to the system to help you make your decision. You also have the diagnosis of this particular sample. So we are looking at non-small cell lung cancer example today. The panel in white here is allowing you to see a quick overview about the variant that you have selected in black. So my EGFR here is selected, and this is information that I can have around EGFR, so quick information about frequency and so forth. You will notice that the tile are color-coded. They are color-coded because it's based on the classification that we have made for those variants. So as I mentioned, they could be pathogenic or actionable and so forth. So the red means pathogenic. So you have on the right side the classification legend. You also have variant flags. Variant flag allow you to see which of the variants are directly actionable. We have an example with EGFR here. You also have another flag that we can see on the TP53 variant, which is the CT flag or clinical trial flag. The clinical trial flag is there to indicate to you that based on this indication, there is indeed clinical trial that might be relevant for that specific variant. Once you want to evaluate a variant and decide whether you report on, it could be automatically done within this window, or you could also go and look at the variant details. And let's pretend that we do not know anything about EGFR and take a look at the detail of EGFR. When I click on the tile, I'm bringing, the application is bringing me to the more detail for that specific variant. So the grayed up section I have not changed, so I still see information about my specific sample. And then I do have the top right section where there is that information about the variant EGFR in the gene. We can see the phenotype. So in this case, we are in a non-small cell lung cancer. And all the information that I have in this white section is driven by this phenotype. So we can see the onset of the disease, the gene prevalence, the level of EGFR, the gene itself. And then the white section here is providing you information about that specific variant. What is the somatic frequency of that variant within that phenotype? What is the population frequency? What is the LF fraction? And this is compute based on the sample that you will have uploaded in the system. You also see the impact of the variant on the protein. So this is an in-frame type of deletion. Below that white section, you can see a lot of different sections, and I will go through the key ones for somatic cancer today. The first one is the variant detail. The variant detail is allowing you to see detail about your variant. It's both computed based on your variant in your sample, and also directly taken from your variant call file that belongs to this sample. You can see, for example, chromosome position, where is that variant, the impact of the protein, the activity, whether it's a gain or loss of function, for example. I will skip to the next section and look into the following, which is called effect on protein. When your variant is an in-frame, in this one, you will see in-frame effect on protein and so forth. So the title that you will see here is driven by the specific variant that you are looking at. So right now we are looking at in-frame effect on protein and the EGFR protein. We have information about the chromosomal location, the exome region, so we know it's the well-known exome 19. You have the HGVS translation in protein, and you know that this is a gain of function. The diagram below the title is allowing you to see key information that we have in the literature and where this variant falls within the protein sequencing, the coding region. So the black lines represent where your variant is. All the blue square represent a different exon of EGFR for that specific isoform. The yellow line is the critical domain of EGFR, so you know that this variant is within a critical domain. The little red line are all other variants that has been observed in the literature, in the knowledge base that we have for EGFR that are pathogenic. So you can quickly see whether your variant is within a hotspot of variation, for example, that are recognized to be pathogenic. Another nice functionality of this section is the idea of isoforms. So every of the protein, most protein may have different isoforms, and you have a toggle that allow you to look at other isoforms to see whether this variant is meaningful for that specific isoform. So we can see, for example, for this one that I just selected, the exon 19 is not present in that isoform. So this variant is not relevant for that specific isoform of EGFR. The next section that is really useful and meaningful for somatic cancer workflow is the idea of treatment. We are creating data in three primary areas that are relevant for clinical laboratory: the drug label, the clinical trial, and professional guidelines. And we can see in the top section of the treatment information a slider bar that allow you to evaluate the treatment information based on the exact variant finding to gene effect finding. So this is from level 1 type of treatment and so on. You can also select, you also have by default your specific indication. So we are looking at lung cancer, or you can toggle and look at any type of treatment in any cancer. But let's first take a look at the exact variant or level 1 trial, treatment and trial. So we can see here that for EGFR, there is two treatments that are available for this particular variation. The evidence is exact variant, so this treatment is really exact. The effect of that treatment is sensitive. So if you have that variation, you are sensitive to that treatment. This is the indication, and this is the references. So currently, the reference for exact variants for that specific drug are only approved by the FDA at this point. So you have that information here. Similar idea with the clinical trial. So you can see any clinical trial that are currently enrolling, and this is really important. We are providing here only the trials that are currently enrolling, so you can report that out and within your report. You see, for example, for exact variant, there is a combination currently enrolling of two different treatments. Again, it's against that exact variation. You have the study title where the trial is currently happening. So this one is in the United States, in the state of Texas. It's in phase 1. And you can even link to the finding and how we curated the information and see the clinical trials.gov. So if I simply click on the blue line, it brings me to the bibliography that we have for that specific trial. And by clicking one more time on the blue line, I will get directed directly to the clinical trial.gov information. So within 2 clicks, I can go look at the record and start deciding whether or not this clinical trial is meaningful for my specific sample. Now let's take a broader look by looking at all the different treatments and trials that we can have for EGFR. So if I use the slider bar and I use the gene positive, what is currently happening now is we're looking at any trial. It's not, or treatment, not related directly to that specific variation in EGFR, but any EGFR variation that is still relevant for lung cancer. So we can see here that there is a few more treatments and the level of evidence is different. Some of those treatments are approved for exact variant or EGFR tyrosine kinase catalytic domain mutation positive. These two treatments here, one thing to notice is they are resistant. So if you have that specific, specific evidence, you are resistant for those treatments. And here is the indication that are meaningful. And same thing here, EGFR mutation present, positive, and so forth. And we can notice now that when we broaden the view, we have all the other information and education based on the guideline, based on the EMEA information as well. Similar to the clinical trial, if I click on the hyperlink, I will get to the bibliography. I can see all the information for the specific references, and I can link again to NCCN, for example, or EMEA and so forth by clicking one more time and looking into the information for EMEA. Okay. With regards to the clinical trial, this is a similar idea. So the clinical trial, now we are looking at all the different clinical trials. We can see much more, a longer list of clinical trials for EGFR. And when you are faced by a list like that, for example, for trial, you may decide that you do not want to report clinical trial that are in phase 1 or phase 2, but you may want to report phase 3 and phase 4. So the little funnel throughout the application allow you to filter. So I will filter here and I will select provide me only clinical trials with phase 3 and phase 4. And then now I focus only on phase 3 and phase 4. Similarly, you can do the same with the location as well of your trial. You can filter based on the location and change your location. One thing that you may have noticed since I started talking about the treatment is this little icon that we have completely on the left-hand side of the screen, both for treatment and both for trial. This is the icon that allows you to control what you want to see in your report. When you have a red line, it is because the specific treatment or the specific trial or evidences is not going to show up in your report. If you want to make a specific trial reportable, you simply click on it, and now you see the line disappear, and these two treatments here will appear now within my report. Similarly, with the clinical trial, I can do the same. And this is true for any finding, and anywhere where you see that little icon, you decide whether or not you will make this specific piece of information reportable. So now I selected 2 different treatments and 1 different trial. You can even broaden your view for treatment and trial one more time by looking at not only lung cancer, but looking at any other indication in cancer or a different tissue. So you may want to look at the effect of the trial of the variation, for example, in a different other tissue. So you can simply change from lung to liver, for example, if you are trying to find something that is located in a trial or treatment that are located in a different tissue. You can also do the similar thing by looking at all cancer. And now you will see not only the lung cancer indication, but all the other ones. One thing to notice is they will be grayed out to indicate clearly to you that these are not trial treatment that are approved for the specific indication that you have within the sample. But you can still see and decide to report if this is meaningful for the case that you are currently studying. Now I will close the treatment section and I will start looking into information that we have in the knowledge base besides the clinical trial and the treatment. QIAGEN Clinical Insight is leveraging all the different knowledge, as I mentioned, to make decisions. So in this particular view called Reported Clinical Case of Non-Small Cell Lung Cancer, it is allowing you to look at all the different bibliography and clinical count that we have for that specific variant in that specific gene in that specific indication. And you have a visual view to look at that and know which finding is coming from somatic findings. In the case of EGFR, we have a lot of somatic. If we were looking into breast cancer, for example, BRCA type of gene, you would be able to see potentially somatic finding as well as family member or family member with segregation or chromosome type of information. So these are the clinical counts that you have based on the different breakdown, the zygosity, as well as the type of information. You can access the entire finding list by clicking View Bibliography, and this is allowing you to see the selected clinical case count for that specific section, for that specific variation in that specific gene. And the time to load the information will depend on the size, how much study this gene and that variant is meaningful. So obviously, for the variation that I choose in EGFR, there is a lot of information. When you get in the section, we can see that there's, at this time today, there's 359 references. Please note that we are updating most of the content of Clinical Insight on a weekly basis, so this number will always be up to date and change. You can see the most relevant information on the top, so this the most recent. So this is the 2015 publication to the least recent. So it's ordered by the publication date. Similar than before, you can decide to report a specific finding. If you expand, every of them will be different. You will have the publication itself. You can link out to PubMed and see where, see the abstract of that publication. You have the piece of evidences that we have curated within that publication. And when available, you will see the number of cases. For example, in this example here, we have 7 out of 38 sample. In this case, this is another example where there was co-occurrence type of variation, not just this one variation, but other variation with AGFR and P53 that we can see really easily. For any of those publications, you can also annotate them. And when you annotate them, this will stay within your institution private section. And it will stay there. So if you come across that exact same variant that has that reference in a month from now, you will see the note, you will see who added the note, and you also see at which time. So you could say, I look at this, and this is additional information that you want member of your organization to know about that specific information. If you look into a specific references and you believe for a reason or another that it should not be included, you could also decide to exclude based on different reasons, such as quality, conclusion is to proceed, and other. So you have also that option, and this will be only for your institution again. This section is really the selected clinical case, and you can go even further into the literature evidences, shall you choose to do so during your workflow, and go deeper into accessing, for example, review article, functional biology type of article, and so forth. And you will do that by clicking on the All tab. And the All tab will provide you at the really top a section that you can filter the type of bibliography. You also have a search box that will allow you to search for author, title, journal, PubMed, and so forth. And you can simply decide to look into the type of references. So we have over 700 references for this specific variant in the gene. So you could decide to filter the bibliography that you are interested. Of course, this is less interesting for something like EGFR, where there's already well-known treatment. But when you get into those variants that are emerging, then you can really go deeper into your publicly into the literature search. There's a few other sections of interest for semantic. The semantic frequency gives you a visual of where is the variant, how frequent it is. So you have the semantic frequency in here. Two other interesting section is the clinical case from other laboratory and your laboratory. So you can see, for example, here other observation of that specific variant in a GFR in different databases such as Cosmic or ClinVar and so forth. And by clicking on the link, you can link out directly to ClinVar, to Cosmic, and see the information of that report. And at the really top, if you remember, I scrolled over one of the section called Laboratory Observations. And this is not COSMIC or ClinVar, but your lab observation. So in the past, if you have seen this variant before and you have made it reportable, then you will see that within this section. So it's really building your experiential databases. And this is, we can see within my colleague at QIAGEN, that we have seen this variant a few times in 2 different samples. And you have the date, you have the phenotype, you have who have seen it, who have decided to make it reportable or not reportable, and so forth. When you're comfortable and you have decided that this variant is of interest, you can click Edit Assessment and report this variant. You can change the phenotype if the phenotype is not appropriate. You can decide a new assessment, so you can go pathogenic, likely pathogenic, and so forth. You can make it reportable or not, add a note. And you will see who else have added note and made that variant reportable. And once you're done, we can see here that this variant is now reportable. We have decided to make it pathogenic, and it's for non-small cell lung cancer indication. And the way to generate your report is to click on the Views and Report section. The first section will be the overall interpretation. This will be computed based on the information that you have selected, which treatments, which literature evidences, whether you have made a variant reportable. You can add a comment to your report, saying comment that are of interest for your report. So I just made an example here, saying this case is positive for EGFR. You have your reportable variant based on their indication. So in this case, I have only EGFR that I made reportable. What is the variant, the allele fraction, the function, assessment, and references that I've selected. And for the specific variant, you also have comments that you can have them. So we add there. So we provide you comment about that specific gene and variant, but you can also edit that comment and enrich the comment that you will be putting into your report. Similarly, with the treatment, you see which treatment you have selected, what are their response, for what they have been approved, what is the indication, the references, and you can see a description about these treatments. You can also add comment as well. Similarly, clinical trial and your references. Now, depending on your workflow of your lab, you may want to send this to the lab director. So, for example, if I am a variant scientist, and my role is simply to look and make sure there is consistency, now I may send that to the next level above me. You could, and if you are the lab director, you would click Final, you would add a few more notes, and it will allow you to do your sign-out process and sign out your report. When your report is signed out, it will generate, depending on how we are integrating QIAGEN Clinical Insight within your system, it will generate for you a PDF, or it can also be retrievable using XML version, depending on your section. The report that you will see are customizable and based on what are your needs. So this is an example to just provide you what can be on the report. If you could, if it's appropriate, provide demographic information about that specific cases. And we are IFA compliant, but this is a decision that you've made yourself, whether you want to have this section. You also have a potential to add specimen information onto your report, overall interpretation, alteration summary, and so forth. And this would be customizable for every different lab. So now, this will end our demonstration of QIAGEN Clinical Insight, and I will simply go within my slide to wrap up with a summary slide. So what we have seen in summary, we have seen that QIAGEN Clinical Insight allow you to see a really quick view of all the different variants and provide you color-coded information and flag information about these variants, allow you to dive within the literature evidences if you are interested and choose to do so. It allows you for somatic cancer to really look into the different treatment and trial and report that out within your report based on the indication and so the level of evidence as well. And then finally, QIAGEN Clinical Insight Interpret allow you to report out the information.